Hi, I am Dr. Chinnu Jomi, medical and hemato-oncologist at Manipal Hospital Whitefield.
Hi, I'm Dr. Madhav. I'm a nephrologist at Manipal Hospital Whitefield.
Today we are going to talk about multiple myeloma. It is a type of blood cancer, but in this disease the implications go way beyond just our blood. What exactly is multiple myeloma? It is a type of blood cancer which specifically affect a particular type of cell in the blood known as plasma cells. So we all know that plasma cells are a normal part of our blood which is responsible for antibody production and our immunity. But when these normal plasma cells get converted into cancerous cells, they divide without any control. This happens in our bone marrow, and this along with the division they produce huge amount of abnormal proteins known as M proteins and free light chains. These proteins can be deposited in any of the organs, particularly in our kidneys, which leads to kidney injury and kidney damage.
Yeah, so this is where the kidneys come into picture. The kidneys are the filters of our body. So when these light chains come in, they clog the kidney system, and this is what we call as a light chain cast nephropathy or a myeloma kidney. This is the most common form of kidney injury that is seen in myeloma patients. As you rightly pointed out, there can be kidney injury because of not just light chains that can deposit in the kidney, but also because of high calcium levels, because of painkiller medications that the patient is on, because of dehydration and some other medications as well. So in fact, many of the patients may actually first present with a kidney disease, and they may come with presentations of leg swelling, they may have low hemoglobin, they may have high calcium, they may have bone lesions, so they may have altered renal functions with an increase in creatinine, protein leakage that is detected, and oftentimes we detect them on kidney biopsies, and you probably advise bone marrow biopsies as well for this.
So how do we treat multiple myeloma? We have a lot of treatment options in this era of medical sciences. So we usually use a combination of immunomodulatory drugs, bortezomib inhibitors, and a steroid drug in the background, along with some bone modifying agents. There are recent drugs which have been used now quite a lot in multiple myeloma known as monoclonal antibodies, namely daratumumab. We have been using it a lot in the frontline treatment of multiple myeloma nowadays. In selected cases, we do prefer a autologous bone marrow transplant as well. Because we have a lot of new drugs, these drugs can be given even if we have compromised kidney functions.
Yeah. So what we do as nephrologists is we try to support the kidneys. If the patient requires dialysis, we do dialysis. We give medications to lower the calcium levels.
So we oncologists usually work as a team with our nephrologist for the tailored management of these patients, because each patient is different. And with a good myeloma treatment and the supportive dialysis, there is usually very good responses, and some of them even come off dialysis.
So basically what we want, what our message is that if you are above the age of 40 years, you've noticed some renal dysfunction, some protein leakage, low hemoglobin and increased calcium, it might be worthwhile to meet a nephrologist and get your blood tested and your urine tested for this.
So basically in myeloma, early detection and diagnosis is the key for a good quality of life, and you can maintain that good quality for a long term. There is no immediate life-threatening problems with myeloma, so early detection is the key.
Thank you.